Hi, I'm Dr. Dan Shapiro. I'm plastic surgeon certified by the American Board of Plastic Surgery. I've been practicing in the Scottsdale Paradise Valley area since 1992, and that's all I do. I just perform cosmetic or aesthetic plastic surgery. I perform, and I've always performed a lot of liposuction. I went down to Columbia to learn some very advanced techniques, high definition liposuction, and I'm very proud in my practice that I have a very low revision rate on liposuction. And I turn away a lot of patients because I feel that they're not candidates for liposuction. And a common thing that I hear from patients who come in for a second opinion is, Dr. Shapiro, I have some liposuction done. I've had it done, and I have more cellulite now. And Dr. Shapiro, does liposuction cause cellulite, and how can it be avoided? How could I have avoided this? The first thing to understand is about how liposuction works. Liposuction works by putting a small cannula in and removing fat. We are trying to gauge what that skin is going to do after the liposuction, and we want to see some good skin retraction to see a nice smooth contour on the new shape that we've created by the contouring the fat. In those patients that I feel that they don't have good skin elasticity, they have pre-existing cellulite, or I feel as though that they won't do well after liposuction, I turn them away. The reason being is that I feel as though the extra cellulite that you may have, the extra dimpling you may have, will be worse than your current state, i.e. you feel as though you look bad because you have some extra fat there, but I can tell you, you'll hate it worse when you have some extra cellulite or skin laxity. So the best way to understand to avoid this is not have the liposuction done in the first place, or have it done by somebody who understands this. I see so many people that I have had come in for consultations, I turn them away for liposuction, and then they come back 6 months later, a year later, and want to know why, after having liposuction, their cellulite is worse. And the best way to understand how this could be avoided is to either avoid the liposuction or have it done judiciously, have it done very specifically. There are certain techniques that I use that help promote skin tightening, that is safe liposuction or vaso high definition liposuction. But even with those techniques, I still am very, very conservative in how I perform the liposuction, because I don't want to see you with problems of extra skin or skin laxity, because I think you're very self-conscious about it. Cellulite caused by liposuction or skin laxity and dimpling caused by liposuction is very difficult to fix. And the best way to try to avoid that is to avoid the liposuction, or have it done by somebody who understands that this is a possible side effect. So the best way to find out if you're a candidate for liposuction, the best way to find out if this technique will worsen your cellulite, the best way to find out if you're a candidate for it and to try to avoid cellulite production is to come in for consultation. We'll go over what options are available for you. I'll specifically show you what areas of skin that I'm concerned about, and come up with a plan for you. Sometimes patients that have cellulite are better served with non-invasive treatments like cool sculpting. So come in for consultation, we'll discuss what options are there for you. Thank you.